Hi, I'm Aurel Enriquez, and this video contains part two of our discussion on Chapter 18 of Mahon's textbook of Diagnostic Microbiology. In this video, we'll now look into the HACEK group and all the other fastidious gram-negative bacilli. Here is the outline of our discussion. So let's look at the other members of the HACEK group, and then let's look into the fastidious gram-negative bacilli. So my coworkers and I refer to this as Ella. Kasi halos lahat sila nagtatapos po yung pangalan nila sa Ella. Okay, so on the next segment of our discussion, pag-usapan natin yung mga Ella. Let's start with the HACEK group. The acronym HACEK consists of the first initial of each genus included in the group. So H stands for Haemophilus, which we already discussed in part one of this video. Next, A is for Aggregatibacter, C is for Cardiobacterium hominis, E is for Echinella corydens, and K is for Kingella species. All HACCP organisms are opportunistic pathogens, which means they require an immunocompromised host, and they're significantly implicated in cases of endocarditis, particularly in patients with an underlying heart disease or prosthetic heart valves. All HACCP members are gram-negative bacilli that are fastidious, and their growth is enhanced with increased carbon dioxide, especially members of the genus Cardiobacterium. So sila po ay capnophilic. They have also been described as dysgonic, which means they grow much slower or they don't grow very well. They're known as causative agents of endocarditis because they're very much attracted to heart valves. So these bacteria attach to the heart valves more so if the valves are damaged or if they have a prosthetic implant. They eventually form lesions, which are called vegetation. So, as shown here in these photos to the left, the vegetation are composed of fibrin, platelets, cells of our immune system, and of course, the growing bacterial cells. Now, people may be wondering if these bacteria are normal flora of the oral cavity, then how do they end up in the patient's heart valves? Now, HACCP bacteria, which normally inhabit the mouth, could cause endocarditis by entering the bloodstream through dental procedures or through periodontal diseases. Now, if you would remember our discussion on chapter 2, yung bacteria po that are known as opportunistic pathogens, they're usually part of the normal flora of a specific body site. So, as long as they stay in their usual habitat, they won't cause disease. But when they accidentally get moved to somewhere else outside of their usual habitat, isa po yun sa mga opportunity para sa kanila to finally cause the disease. So sometimes when people have tooth diseases or when they get dental procedures done, these bacteria accidentally enter the bloodstream through the vessels in the pulp of their teeth, as we can see right here in this illustration. Now, after that, they go through the systemic circulation until they reach the heart. So, in the heart, they stick to the heart valves and the infection would proceed. So that's how HACCP members who normally exist in the oral cavity are able to cause endocarditis. Since we've already discussed Haemophilus species in part one, let's proceed with the Aggregatibacter species. First up is Aggregatibacter apherophilus. They have been known as foam-loving bacteria, but when we say foam, we're not actually talking about foam like bubbles. This is just another term to indicate that they like increased carbon dioxide concentration. So they're basically capnophilic. Two species formerly under the genus Haemophilus were reclassified as Aggregatibacter apherophilus. So noon po, Haemophilus aprophilus and Haemophilus paraprophilus were two separate species, but now it's just Aggregatibacter apherophilus. They could be found from dental plaques and gingival scrapings and are capable of causing congestive heart failure. On the chocolate agar plate, this is how their colony morphology looks like, and they could either be X factor dependent or independent. Next is Aggregatibacter actinomycetum comitans. Aggregatibacter actinomycetum comitans was formerly in the genus Actinobacillus, so na-reclassify din po siya. This one is also a normal flora of the oral cavity of humans, and the disease associated is periodontitis, which would eventually lead to the destruction of the alveolar bone. So yung alveolar bone po, it's basically the socket where our teeth would fit inside. So as we can see right here in this example, on figure 18.3, it shows us a photo of advanced periodontitis. So again, isa sa mga culprit nito is Aggregatibacter actinomycetum comitans. And of course, as previously discussed, this could also cause subacute bacterial endocarditis. It's divided into 6 serotypes, and its primary virulence factor is collagenase. All right. So, as the name implies, no, you would be able to understand that collagenase targets the structure of collagen. Diba? It could destroy the structure of collagen. And this is basically toxic to polymorphonuclear cells or yung mga neutrophils and also monocytes. On microscopic morphology, they have been described as gram-negative, small bacilli to cocoid. All right, halos papunta na daw po ng koksay yung shape nila. They grow better with increased carbon dioxide concentration, which fits the description of being capnophilic, and the duration of incubation is 24 to 48 hours. So again, medyo mas matagal po yung duration of incubation nila before we report them as negative. Dahil ulitin natin, they are dysgonic, diba? They are slow growing. With regards to their colony morphology, they've been described as a star shape with 4 to 6 points, as we can see right here in this photo to the left. Next is the letter C in HACEK, which stands for Cardiobacterium hominis. They are pleomorphic, non-motile, fastidious, gram-negative, which if you haven't noticed, they all are. Okay? Almost all organisms in this chapter, ganyan po ang description. So aside from the oral cavity, this could also be found in the throat and gastrointestinal tract. Cardiobacterium also causes endocarditis, although it specifically infects the aortic valves. Occasionally, this could also cause meningitis. Cardiobacterium hominis is also capnophilic and will grow slowly on BAP or CAP. Recall time? Recall time. What term do we use to describe slow or poorly growing bacteria? Dysgonic. Okay. So again, Cardobacterium are capnophilic and dysgonic. Let's look at its colony morphology. They are capable of pitting the agar, which these are small, shallow holes or dents on the agar, which you'd be able to observe if you check underneath the colonies. So let's look at figure D, which is right here. So initially po, may colony na nakalagay sa ibabaw na to. So if you swipe or try to pick up those colonies, you'd be able to see underneath that. So sa ilalim daw po ng colonies, makikita natin na parang nasira yung culture media. No? So again, that is referred to as pitting of the agar. Microscopically, they could form rosettes or these flower-like arrangements of bacterial cells. They could also produce swellings that look like teardrops, and sometimes they could also produce long stick-like filaments. Okay, so pasok talaga siya dun sa description ng pagiging pleomorphic because their appearances may vary. Next is the letter E in HACEK, which stands for echinellocorridans. This is a normal flora of the oral cavity, but also of the bowels. Now, most infections associated with this organism have been polymicrobial, which means the infection is not caused by only echinellocorridans, but by multiple different bacteria. The infection often occurs as a result of trauma, especially after human bites or fights after the skin has been broken by human teeth. So, from the oral cavity, it is transmitted to an open wound. This is why the wound infections caused by Echinella coridae has been referred to as clenched fist wounds. So, andito po ulit yung usual description ng mga fastidious gram-negative bacilli, which is that they are fastidious, non-motile, gram-negative, and they could appear as cocoa bacilli, and they grow best with increased carbon dioxide concentration. So again, it means that they are capnophilic. And for Echinella corridans, they also grow better with the supplementation of hemin, okay, or the X factor, di ba po? It's also a saccharolytic, meaning it could not utilize any carbohydrate. And as you can see right here, they are non-hemolytic with a bleach-like odor on PAP or SBA, and 45% of the isolates also have the capability of pitting or corroding the surface of the agar. So tulad nung nakita natin kanina, kaya niya rin daw pong parang butasin or sirain yung culture media sa ilalim ng colonies. So again, Echinella corridans is also capable of pitting or corroding the surface of the agar. Next is the letter K in HACEK, which stands for the Kingella species. So listed here are the 6 different species, and let's look at the diseases associated. So Kingella kingae has been associated with osteoarthritis in children and also endocarditis. Meanwhile, Kingella dinitrificans has been observed only to cause endocarditis. Now, the Kingella species have the capability to grow on Neisseria selective agar. Okay, ulitin po natin yung mga culture media na pwede nating gamitin for Neisseria species. Kaya din daw po mag-grow dito ng Kingella species. So, an example of this is the modified Thyre Martin agar. And they may also resemble Neisseria gonorrhoeae on culture. So, although Kingella species is classified as a gram-negative bacilli because they have a gram-negative cell wall, they have been documented to resist decolorization in gram staining. So sometimes they might appear gram-positive, as we can see right here in this example, here in figure 18.9. All right. So they have been described as cocobacillary to short bacilli with squared ends. Again, tignan po natin itong figure 18.9. Again, they have a gram negative cell wall, but they are capable of resisting decolorization, which is why they might appear gram positive. Now, with regards to their colony morphology, they are beta hemolytic, as we can see right here in this photo. This slide shows us a summary of all the important reactions and characteristics of the HACEK group, which could be found on table 18-4 of Mahon 7th edition. And that was for the HACEK group. Let's now proceed with all the other fastidious gram-negative bacilli. Sapnocytophaga belongs to the family Flavobacteriaceae. There are at least 14 species, and 6 of them are normal flora of the oral cavity of humans. Enumerated here are the clinically significant Capnocytophaga and the diseases associated with them. So, Capnocytophaga orchosea is the most common isolate. Capnocytophaga canimorsis could cause septicemia after a cat or dog bite, and Capnocytophaga hemolytica is known as the beta hemolytic Capnocytophaga. Next, they rarely cause endocarditis. Rather, Capnocytophaga is more known to cause septicemia, more so for patients with neutropenia. So, what do we mean when we say neutropenia? There is the decreased number of circulating neutrophils. Okay, so again, this could lead to septicemia, more commonly observed among patients with neutropenia. As for their colony morphology, although Capnocytophaga is non-motile, their colonies display a gliding motility, as we can see right here on figure 18.20. Most of these are non hemolytic except for one species that has been observed to be beta hemolytic, which has been appropriately named Capnocytophaga hemolytica. In microscopy, they resemble fusobacterium because they have pointed ends. This slide lists down their biochemical characteristics. Capnocytophagus species are capable of fermenting sucrose, glucose, maltose, and lactose. So medyo madami po yung carbohydrates na kaya nilang gamitin. Again, it's sucrose, glucose, maltose, and lactose. All six species found in the human oral cavity are negative for catalase and oxidase, except for Canimorsis and Cynodemy, which are positive for both catalase and oxidase. Pastorella species is found normally on the upper respiratory tract of both mammals and birds. Pastorella are fastidious gram-negative cocobacilli that may resemble safety pins due to bipolar staining. So seen in this photo at the bottom left corner, the ends of each cell are stained more intensely or they appear darker compared to the rest of the cell. Now, the most common isolate for this genus is Pastorella multocida. The most common form of pastorellosis is cutaneous pastorellosis. This photo shows the leg of a patient who suffered from bacteremia and necrotizing fasciitis after having been bitten by a pet cat. So ito po, yung dahilan kung bakit pag nakagat o nakalmot po kayo ng aso o pusa, maliban sa anti-rabies and tetanus vaccines, you may also be prescribed with antibiotics to avoid infections by these bacteria that could be acquired from the oral cavity of those animals. So, at times, they may also lead to systemic infections as enumerated here. The colony morphology of Pastorella on sheep blood agar appears mucoid after 24 hours of incubation, and after extending the time to 48 hours, the colonies would then produce a green to brown colored halos, as we can see right here on this photo to the left. All right, so ayan po, here is the colony morphology of Pastorella species, and listed here are their biochemical test results. They would test positive for catalase, oxidase, and indole production. And it's only capable of producing, or sorry, it's only capable of fermenting one carbohydrate, which is glucose. Brucella species are zoonotic pathogens, which means that they could cause disease to both animals and humans. And humans are also able to acquire the infection from animals. There are four species commonly associated with human infections: Brucella abortus, melitensis, suis, and canis. Now, out of these four, the most common isolate is Brucella abortus. Now, take note that Brucella is listed as a Category B biological agent by the Centers for Disease Control and Prevention. So, Brucella is seen as a potential bioterrorism weapon. Most of their general characteristic is the same as the previously described organisms in this chapter, and they're also non-encapsulated, non-spore forming, and must be handled in a biosafety level 3 facility, since again, this organism could potentially be a bioterrorism agent. Modes of transmission include aerosol, oral, and percutaneous modes of transmission. There are three clinical stages to brucellosis, and the first is the acute stage, which happens within 1 to 4 weeks after exposure. So medyo matagal po, no? Medyo matagal ang incubation period ng disease na ito. So symptoms are non-specific, such as fever, headache, anorexia, and myalgia. Next is the subchronic or undulant form, where this is where the characteristic manifestation of brucellosis is observed. Okay, so dito na po nanggaling yung pangalan na undulant fever sa subchronic stage. All right, so the patient experiences undulant fevers where the temperature is normal during the day, but it rises during the afternoon or evening. So yun po yung ibig sabihin ng term na undulating, taas baba yung temperature nung pasyente. So normal temperature during the daytime, and then their temperature rises, causing them to have a fever during the evening. So again, that's the undulant fever observed during the subchronic stage of infection. Chronic stage of brucellosis happens a year after exposure, and systemic symptoms such as arthritis may be observed. Appropriate culture media includes sheep blood agar, chocolate agar, as well as the modified Martin and Martin Lewis agars that are typically used in the isolation of Neisseria. So again, the modified Martin agar and the Martin Lewis medium, which are formulated for the isolation of Neisseria gonorrhoeae, could also be used to isolate the Brucella species. Keep in mind that Brucella species are slow growing. So, although colonies may be observed in as early as 18 hours of incubation, the plates should be kept for as long as 4 days before reporting as negative dahil nga po madalas mabagal silang tumubo. On BAP, their colonies appear smooth, raised, translucent, and non-hemolytic as shown here on this photo to the left. Taken directly from Mahon's textbook of Diagnostic Microbiology, here is a table showing the differential characteristics of Brucella species that cause human infections. So pinapakita din po dito sinong mga hayop ang natural hosts nila. Next is Francisella. Francisella has four subspecies, namely Francisella tularensis, subspecies tularensis, subspecies holarctica, subspecies novicida, and subspecies mediasiatica. Now, same with Pastorella and Brucella. Francisella is a zoonotic pathogen that causes tularemia, also known as rabbit fever, and listed here is its different modes of transmission, which, as you could see, there's a lot. Okay, ang dami po nating options. There's so many different routes to acquire tularemia. So on the next slide, let's talk about tularemia. The most common form of tularemia is ulceroglandular. In ulceroglandular tularemia, an ulceration forms at the inoculation site and the lymph nodes within its proximity becomes enlarged. There are many other forms of tularemia like pulmonary, oropharyngeal, oculoglandular, and so on. Just as the other previously tackled organisms, Francisella tularensis is also considered as a potential bioterrorism agent, placed at the category A by CDC. Francisella tularensis is a small, non-motile, non-spore-forming gram-negative bacilli that are strict aerobes. Okay, so as fastidious bacteria, it requires the following sources of nutrition: cysteine, cystine, and thiosulfate. Okay, ulitin po natin. Francisella tularensis is a fastidious organism. When we say fastidious, they require very specific nutritional sources for them to grow. And again, for Francisella tularensis, it's these three: cysteine, cystine, and thiosulfate. Okay. Now, listed here on the left are the appropriate culture media for the isolation of Francisella tularensis. And note that this organism will not grow on McConkey and also not on the Eosin methylene blue agar. Even though growth may be observed in about 48 hours, plates must be checked daily for up to 14 days before reporting as negative. So, ganun po katagal yung possible na duration of incubation nila. So, sobrang dysgonic, sobrang slow growing po ng Francisella tularensis. Colony morphology is as shown on the right. So they could produce a grayish white color. They are smooth and raised. Next is Legionella pneumophila. Legionella pneumophila was named due to its historical background. Way back in 1976, in a convention of the American Legion, 221 persons became ill with pneumonia and 34 of them died. The causative agent was later on identified as Legionella, and the disease was termed as the Legionnaire's disease. There are two forms of legionellosis. Legionnaire's disease is a febrile illness with pulmonary involvement. So, if the patient does not present with pneumonia, then the disease is simply known as Pontiac fever. So, basically, mas severe yung Legionnaire's disease and mas mild po ang Pontiac fever. The incubation period of legionellosis could range from 2 to 14 days. Legionnaire's disease may sometimes also be referred to as atypical pneumonia. Other organisms known to also cause atypical pneumonia include Mycoplasma pneumoniae and Chlamydophila pneumoniae. So, clinical manifestations are non productive cough, fever until the disease progresses to the development of pulmonary infiltrates with bloody sputum, which could sometimes be confused with tuberculosis. Now, what are pulmonary infiltrates? Pulmonary infiltrates are abnormal substances like pus, blood, fluid, or cells that accumulate in the lungs, making it denser than air. So, pulmonary infiltrates could be observed on a chest x ray or other imaging test, as shown here in these examples. So again, kapag ganyan po, no, may pulmonary infiltrates na sa lungs ng pasyente at nagpo-produce na ito ng bloody sputum, that is the Legionnaire's disease, the more severe form of legionellosis. For the milder version of legionellosis, which is Pontiac fever, the incubation period is also 2 days after initial exposure, is self-limiting and would only last for up to 5 days. Okay, so pag sinabi nating self-limiting, even without medical intervention, the person could recover from this infection. So Legionella pneumophila could be found worldwide from both natural and man-made water sources. Okay, so dun po natin na-acquire ang Legionella pneumophila from water sources. Now, what are the factors that has allowed Legionella to survive in such a wide range of water supplies? Okay, so first up, they can tolerate chlorine concentrations of up to 3 milligrams per liter. And as we know, chlorine is commonly used in swimming pools, di ba po? So swimming pools, colonized. Legionella can continuously multiply even at temperatures as high as 43 degrees Celsius, and it still can survive at up to 60 degrees Celsius. So, hot springs and jacuzzis colonize. They can adhere to pipes, rubber, plastics, so that would include industrial water coolers and respiratory therapy machines and also air conditioning systems. Okay, so all of that colonized. Okay, so in summary, these organisms can be very tough and difficult to get rid of, and they feel like any equipment that has to do anything with water is free real estate. Okay, so ayan po, again listed here are the different factors that allow Legionella species to colonize water supplies. So in comparison to a lot of the other species that we've discussed in this chapter na zoonotic yung transmission o kaya normal flora ng humans, ang Legionella pneumophila po, no, it's not zoonotic, it's not a normal flora, but it's present in the environment. And again, it's capable of contaminating water sources. Since legionellosis is a respiratory disease, appropriate sources of specimen would be sputum, bronchoalveolar lavage fluids, or For purposes of public health investigations, in cases of an outbreak, environmental samples may also be collected. If there are delays in processing for about 2 hours, refrigerating the specimen is fine, but if the delay will take a few days, the samples must be frozen at negative 70 degrees Celsius. Under the microscope, they appear pleomorphic, weakly staining gram-negative bacilli, as we can see right here in this photo. So this is the gram stain morphology of Legionella pneumophila. To be able to effectively isolate Legionella from clinical specimens and minimize the growth of contaminants, specimens must first be treated with acid, as explained here. Although they can survive at a very wide range of temperatures, their optimum growth temp is still at 35 to 37 degrees Celsius. Growth may be visible within 3 to 5 days, but it is recommended to keep the plates for up to 7 days before reporting as negative. Please take note of the preferred culture media, which is the buffered charcoal yeast extract agar, or BCYE. So here, the term buffered means that its pH has been adjusted to 6.9. And again, this also already contains L-cysteine as a nutrient source. If the specimen was both acid washed and plated on a selective BCYE, less contaminating organisms may be seen and the actual Legionella colonies could be observed, as we can see right here in these examples. So, colonies appear to be small, grayish white to blue green, glistening, and was described to have a ground glass appearance. So, ground glass in Filipino is parang durog na salamin. Okay, so ganun daw po yung itsura ng colonies ng Legionella pneumophila. Other identification methods include checking if the organism requires L-cysteine for growth and the use of direct fluorescence antibody, or DFA. If we choose to do DFA, bacterial cells will appear as fluorescent green specks under the microscope. So here they are at 450 times magnification, and here they are at 1000 times magnification. Up next is the Bordetella species. There are two species implicated in human infections, Bordetella pertussis and Bordetella parapertussis. But there are other miscellaneous species that have been associated with a number of various infections listed here. So let's go through them. Bordetella bronchioseptica is an opportunistic pathogen. Bordetella avium is observed among domestic animals. So this is a domesticated animal pathogen. Bordetella hinsii is an avian commensal. Bordetella harmsii is observed among immunocompromised patients with bacteremia. Bordetella ansorpii could be isolated in cases of septicemia, and Bordetella trematum could be isolated from wound and ear infections. But again, in this discussion, we'll focus on Bordetella pertussis and Bordetella parapertussis. On the table below, taken from our reference textbook, are the differential characteristics between Bordetella pertussis, parapertussis, and bronchioseptica. For the general characteristics of Bordetella, they are obligate aerobes, non carbohydrate fermenters. They can oxidize amino acids, and aside from being catalase positive, they are relatively inactive in all other biochemical test systems. Onto these specific species, let's first look at Bordetella pertussis. It can easily be inhibited by many compounds, so they need protectants such as charcoal, blood, and starch. Now, what virulence factors does Bordetella pertussis have? The most significant out of all of them would be the pertussis toxin that has the ability to modify host proteins. Other virulence factors include filamentous hemagglutinin, which helps them adhere to surfaces of the ciliated respiratory epithelium. Adenylate cyclase inhibits the action of immune effector cells. And lastly, the tracheal cytotoxin that causes ciliostasis or paralysis of the sweeping motion of the ciliated epithelial cells, pretty much like the outer membrane proteins of Haemophilus influenzae. But the difference is that tracheal cytotoxins of Bordetella pertussis could also cause cell death by inhibiting DNA synthesis. Bordetella pertussis is the causative agent of whooping cough, and this disease has three phases. So the first one is the catarrhal phase, which presents with very nonspecific symptoms but may cause respiratory distress and apnea or the cessation of breathing for infants. At the paroxysmal phase, we get to hear the characteristic whooping sound at the end of each bout of coughing. And this is due to the patient rapidly gasping for air. Finally, at the convalescent stage, the coughing spells decrease in frequency and the patient finally recovers after a few weeks. Okay, so dito po ang kailangan nating tandaan ay yung paroxysmal phase. Dahil sa paroxysmal phase po, doon natin ma-observe yung whooping sound sa whooping cough. Okay? So, pinangalanan siya dun sa clinical manifestation na pwede nating ma-observe sa second stage or dun sa paroxysmal phase nung infection. Basically, tuwing umuubo yung pasyente, parang may whistling sound sa dulo. Kasi nga po, paulit-ulit yung pag-ubo niya at nahihirapan na yung pagdaan ng hangin. So, yung mahirap na pagdaan ng hangin ay nagpo-produce ng parang whistling sound or yung whoop na naririnig po natin when the person is coughing. For Bordetella parapertussis, all we need to know is that it causes a disease somewhat similar to pertussis but milder, since it also has the pertussis toxin gene but does not express the complete functional unit or operon. So again, if we're talking about Bordetella pertussis causes the more serious illness. Meanwhile, Bordetella parapertussis causes the same illness but with milder symptoms. Sources of specimen are nasopharyngeal swabs or aspirates, and acceptable swab materials would be Dacron polyester. So as we can see right here in this illustration, ito po yung correct method of collecting nasopharyngeal swab for the diagnosis of Bordetella infections. And gram staining, extending the time of contact with safranin for up to 2 minutes or using 0.2% basic fuchsin may be used as a counter stain to enhance the visibility of the organism. Direct fluorescent antibody method may also be used but should not be considered as a replacement for bacterial culture. So, speaking of bacterial culture, what are the recommended culture media for Bordetella and how would their colonies look like? There are two culture media well known for isolating Bordetella species, and these are the Bordage on Go potato infusion agar and the Regan low selective agar. Bordetella pertussis generally grows faster with colonies readily observable within 24 hours of incubation, but Bordetella pertussis takes up to 3 to 5 days to grow. Okay, so before reporting as negative, plates should be kept for as long as 7 days. So as shown here on the left, the colonies of Bordetella have been characteristically described as mercury droplets, appearing to be small, shiny, and almost silver in color. All right, so again, those are the mercury droplet colonies of Bordetella pertussis. Here are the references that were used in the making of this discussion. Tapos ang midterms. All right. So ayan po, no, if you belong to our school, this is the last topic for the midterms period. If you belong to a different school and you're watching this, comment below. I would like to know, no, which other schools were able to find this channel. So ayan po, if you haven't subscribed, maybe consider clicking subscribe. Ang dami na nating natutunan. Ang dami ko na lecture sa inyo. Hindi ka pa rin nagsusubscribe. Mag-subscribe ka na. Tapos since katabi niya lang yung like, pinutin mo na rin yung like. All right, so that ends part two of our discussion on chapter 18 of Mahon's textbook of Diagnostic Microbiology, which talks about the HACEK group and other fastidious gram negative bacilli. This has been Aurel Enriquez. Thank you so much for watching.